We will introduce the major demographic trend of population aging in the United States, its impact on healthcare costs, and strategies to mitigate this impact. This analysis includes relevant examples to illustrate the scope and magnitude of this demographic shift and its implications for the healthcare industry. Introduction to population aging. Population aging is a global phenomenon, but it is particularly pronounced in developed countries like the United States. According to the U.S. Census Bureau, the share of the population aged 65 and older is projected to rise from 16.9% in 2020 to 22% by 2050. This demographic shift is driven by several factors, including declining fertility rates, increased life expectancy, and the aging of the baby boomer generation. The aging of the U.S. population has far-reaching implications for various sectors, including healthcare, housing, transportation, and social services. Impact on healthcare costs. The aging of the population is expected to drive up healthcare costs substantially in the coming decades, putting significant pressure on public and private healthcare financing systems. 1. Higher utilization of healthcare services. Older adults, on average, utilize more healthcare services compared to younger age groups. This higher utilization is driven by multiple factors, including chronic conditions, functional limitations and disabilities, and higher risk of acute care episodes. Example: Medicare spending by age group. According to data from the Medicare Payment Advisory Commission, per capita Medicare spending in 2019 was significantly higher for older age groups, highlighting the significant cost burden associated with caring for an aging population. 2. Prevalence of multiple chronic conditions. As individuals age, the likelihood of having multiple chronic conditions increases. This complexity can lead to higher healthcare utilization, increased risk of adverse events, and higher overall costs. Example: cost of multimorbidity. A study found that Medicare beneficiaries with 5 or more chronic conditions had average annual healthcare costs that were nearly 5 times higher compared to those with no chronic conditions. 3. Technological advancements and innovative treatments. While these advancements have the potential to improve health outcomes, they often come with higher price tags, significantly increasing healthcare costs. Example: cost of cancer care for older adults. The average cost of cancer care for patients aged 65 and older was significantly higher, partly attributed to the increased use of newer and more expensive cancer treatments. 4. Long-term care costs. As the population ages, the demand for long-term care services is expected to surge. These services can be particularly costly, especially for those without adequate insurance coverage or personal resources. Example: long-term care insurance and Medicaid. Individuals often rely on long-term care insurance or Medicaid to help cover the costs of long-term care services, but the availability and affordability of long-term care insurance have been declining. Strategies to mitigate the impact of population aging on healthcare costs. These strategies involve a combination of prevention, care delivery innovations, and policy interventions. 1. Promoting healthy aging and preventive care. Focusing on preventive care and promoting healthy aging can help reduce the burden of chronic conditions and disabilities, ultimately lowering healthcare costs. Example: chronic disease management programs have been shown to be effective in improving health outcomes and reducing healthcare utilization among older adults with chronic conditions. 2. Promoting age-friendly communities and environments. Creating age-friendly communities and environments can facilitate independent living, promote social engagement, and reduce the risk of falls and injuries among older adults. Example: Age-Friendly Boston Initiative. The initiative aims to create an environment that enhances the quality of life for older residents, including efforts to improve housing accessibility, transportation options, and community engagement opportunities.